Well, good afternoon. I'm Aaron Offsteyer. On behalf of the West Michigan Policy Forum, we want to welcome all of you today and invite you to stay on mute, but feel comfortable going off mute when you want to share. This is the second in a series of West Michigan Policy Forum discussions on how to bring Michigan safely back to work. Today, our main focus is on manufacturing and construction. In addition, we have several other business leaders on the call and executives from Grand Rapids, West Coast and Lakeshore Chambers, as well as leadership from the Right Place and Talent 2025. We also have about 10 members from media organizations around the state listening in. Let me welcome Doug DeVos, co-chairman of the Amway Corporation and the past chairman of the West Michigan Policy Forum, who has agreed to moderate today's discussion and remind all guests to stay on mute, but turn off mute when you want to jump in and share. Hello, Doug.
Hello, Aaron, and thanks for that reminder. I can't tell you how many times I've forgotten to turn my mute off, and I've been just rambling on and not gotten through to people. Thank you, all of you, for joining in this conversation. Can't tell you how important it is at these times to see friendly faces, even if we're all in different locations, but we also have a chance to be together. And as Aaron said, we've got a lot of leaders from the chambers. In fact, the West Michigan Policy Forum came out of the Chambers of Commerce, and then it continues to work very, very closely with chambers. We have a lot of our West Michigan Policy Forum board members who will be joining in as well in this discussion. But the key here is to hear how CEOs locally are dealing with this, whether you're essential or non-essential. And I hate that designation because every business, every job, in my opinion, is essential. I understand it, but I think the focus, as Aaron said, is this whole idea of working safely, and that we've learned a lot in the recent days and weeks of how to do that. I know at Amway, we started this in January when COVID-19 was starting to move through China. And so we've learned with a lot of all the global companies about some of the ways to deal with these sorts of things. And so the body of understanding and learning helps to get us beyond fear and get us to understanding some ways of moving and working safely. So we're hoping to get a little momentum out of talking to you, get encouragement from what many of you are doing, how you're thinking about it, where you're taking it. And we seem to be at a time where there's a lot of momentum around the country or around the state talking about, hey, we got to think about getting back at it, reopening our economy. A lot of people have been working a lot of different ways, so maybe getting back to work isn't the exact right term. But the idea of moving forward from here, of overcoming our fears, using data, using science, and using best practice, and that's really an idea that we have here. There's lots of plans out there. The House has put out a plan. We've seen other business groups put out plans. There's other states and things of that nature. Senator Shirkey has put out a plan that we've been a little closer to. That's really excellent in some of the ideas of a phased approach of understanding the differences of a very big and diverse state, of understanding geographic stages that we may want to go through. But the key really is those best practices to make sure that every employee has the confidence that they are going to be safe when they go back to work. So, really that's our focus here, that we're very aligned with Senator Shirkey's plans. And many of the plans that I've seen as well have many of those elements. So there seems to be some coalescing or alignment across the state. Again, we want to be smart about this, using data, using science, connecting with our health professionals who are really helping us. For some of us, we didn't understand a lot of this, who really understand it, and they're fully engaged in helping us as we go forward. Regional, phased approaches, having those medical experts there, that's really where the policy forum is, and to coalesce around a plan so we can start moving forward, overcoming the fear and finding that pathway to restart our economy. So there's lots of things that we can learn, and that's why we want to be here to learn from you. So let me start a little bit and maybe start asking the first group. And I'm going to call on a few folks here as we go along to keep the conversation going, because that's really the important part of this. Let's start in the first area talking about how we can ensure that safe working environment. And there's lots of different types of workplaces represented on this call that are really important. We can still learn from each other, even if it's a workplace that's not similar to yours. We want to make sure we keep sharing those good ideas. So let's start with Mike Van Gessel from Rockford Construction in the construction area. Hey, Mike, can you kind of unmute yourself and then talk a little bit about some of the things that you're doing to ensure that that safe environment and help build that confidence with your employee base?
You got it, Doug. Thank you. Can everybody hear me?
We got you.
All right, perfect. So yeah, I appreciate it. We have been working hard at this, as you can all imagine. We are a bit of a living laboratory. We have both active jobs and non-active jobs, or essential or non-essential, as Doug explained. So we've had this ability to, in real time, be doing and practicing these things in preparation for what we all hope for is a return to work here very shortly. So let me kind of frame it a little bit, and then I can be as specific and happy to handle some questions. So we fall under, as probably most of you know, MIOSHA, but more broadly OSHA. And OSHA has really adopted the CDC guidelines. And those CDC guidelines are important because what they've done is they've ranked what they call very high exposure, which are basically our medical professionals who are within 6 feet of positive COVID-19 patients. And then what they would consider low exposure, and it's actually a pyramid, and maybe many of you have seen the graph. I think it's a well done graph. So we fall as a construction industry under that low exposure. And then if you think about the construction industry, then there's layers of, we as an industry are low exposure, but then underneath that there's layers, right? So for example, the road builders would be even a lower exposure because those guys easily can keep social distancing. Many of them work on individual pieces of equipment or capable of being distanced from each other. And then steel erection would be another example of that, et cetera. Then you get into more confined spaces inside the construction industry. Those become a little bit more high risk. So you kind of granulate those, and we can bring layers of the construction industry back. The construction industry as a whole is low risk, and then we have our own tiers of risk inside that. So, you know, our proposition is at least let us understand where we have our risk inside of a low risk environment and get us back to work. So that's step, I think, number one is just a basic framework of our industry. So we start there. So, you know, as it relates to things that really the entire industry is starting to well, let me say one more thing about the industry, and then I can be specific. So,
Okay.
And I know I want to keep this brief, but we are really, as an industry, we have really good things in place that we're prepared for this type of thing. So we have communications and protocols in place, and we're always working with our site personnel. We obviously have daily huddles. We have what we would already have restricted access. So we have the ability to keep people from the job site, and we don't have to let anyone, you know, come on the job site. And they are now filling out forms that they have to be focused on. So we have, as an industry, we're always using PPE. And we're really in a situation where we're controlled to the general public. They can't get there. So things that we've adopted on our sites, the sites we have operating, we have thermometers at this point. All sites now have sinks where guys can wash their hands and gals can wash their hands. We're using face masks. Teams are kept together, so we're not introducing new people to each other. Everybody's now wearing gloves. And all of our job site meetings have turned into stretch and flexes, so they're actually outside. There's a exercise involved with it. There's a discussion about what the daily tasks are, and it's no longer in the job site. Job sites are also being disinfected on a daily basis. So those are just some of the specifics that we're rolling through. But I think we're in good shape, Doug. I really hope that come here, you know, in the next 10 days, we're bringing layers of this back to work and really getting our industry activated and getting beyond this essential, non-essential language and letting us as an industry determine under our guidelines that I think we can operate in and really get back to work. Thank you.
Great. Thanks, Mike. We'll keep going through, and then maybe we can open it up for a little discussion after a few more questions. But Bill Dobbins, can I call on you? So at Caster Concepts Manufacturing, how do you view some of the things Mike's talking about? It's a different industry that you have. And how do you connect the dots with some of the proposals, especially what Senator Shirkey's put out there, and others, those main themes? Help us, maybe give us a view of how you're looking at it.
Yeah, thanks, Doug. We're about 100 employees in 3 different locations. One location is the primary one where there's 65 employees, and we're not a production type manufacturing. It's more of a job shop. So we naturally have people spread out. We've had a couple areas where people initially were not 6 feet apart. We've been easily able to adapt to those. So we've been working right along, frankly, and continuing to adapt our practices to what the CDC has come out with. And so the idea that we are not providing a safe work environment, I think is just not accurate. We are working extremely hard following the guidelines. We take temperatures every morning on everybody that comes in. Nobody comes into our facility unless they're an employee. Any sort of logistics people wait at the door until they're addressed. We take health histories when they come in. The employees come in. They are all sanitized. They've sanitized their hands. We spend 3 times a day, we completely spray down all work surfaces with 70% isopropyl alcohol. Every group of worker has their own spray bottle of isopropyl alcohol to wipe down their own tools and to wipe down their touch screens that they use to enter job work. We feel very, very confident in the safety of our work environment. In fact, most of our employees feel safer at work than they do at home, frankly, because they know how hard we're working at making it safe. They're in a common group of people. We try to focus on the things we have control over, the things I have influence over, and then try not to pay attention to the things that I don't have influence or control over. So we have control over our work environment. I can influence my workers, as far as what they do outside the shop, but there's a lot of things I don't have control over. I can do everything right here, and somebody can be an idiot at home and bring the virus in. I understand that. On the other hand, the idea that we're not able to provide a safe work environment, I think is just, again, not accurate. I'm totally impressed by the work that Mike's done and the processes that they're bringing, and I just hope and pray, frankly pray, because of the people that are getting damaged by this, that we can move forward in a safe way.
Great. Thanks so much, Bill. Thanks for that. And I think that's the whole idea to keep share the understanding of how we can move forward. So thank you for sharing that. Brian, maybe fill us in a little your business, Brian Cooper, and what your thoughts are, a little bit of what you're doing and how you're thinking about or reacting to some of the ideas of how we could move forward. Brian?
Sure, appreciate it. We have about 70 employees just in Jackson, and then obviously we have a global sales staff and distribution centers. We're an original equipment manufacturer in the robotic and semi-automatic welding industry. We got a little bit ahead of the curve here in terms of late February. We started putting some policies in place regarding similar to what Bill Dobbins was referring to with 3 times a day sanitizing of all common surfaces and areas, things like that. We have been fortunate enough to have been able to be deemed essential through government contracts and things like that. So difficult to run with a mission critical staff, but as Bill was alluding to, the staff here feels very comfortable at work and to the point where they're a little hesitant to see people come back through the doors. We have put together a return to work protocol that involves temperature logging and health history questions outside prior to entry every morning, which we also do the same thing if they were to leave the campus for lunch or something like that. We've already, we're continuing on with our 3 times a day sanitizing breaks, procured large quantities of gloves and masks. And then we have sanitizing stations throughout the building where we procured large amounts of hand sanitizer and then put into smaller bottles, as well as the building being locked down at all times. We only have 3 people outside of 2 ownership that are allowed to use a key to enter the building. So everybody must go through the same protocol, including myself and our other owners. So so far the response has been great. You know, from our angle, similar to what some others have said, it's just you know, we feel that we did what was necessary to protect lives, but you know, now I think we're at a point where we need to start protecting livelihoods and make sure that people have jobs to come back to.
Yeah. So I like, you know, I think, you know, Bill, you said the same thing as Brian, that to a certain extent you're safer at work because all these protocols. You know, I like being clean, but I'm not doing it 3 times a day at our house. I can tell you that, you know, or probably with the same rigor that's being done. So, you know, so hats off to both of you and what you're doing. That's fantastic. But we'll keep kind of going around a little bit. We'll go to Sturgis Molded Products, and Kelly Presta can dive in. And again, you know, what are some of the issues that you're seeing for, you know, so we can go through the protocols like we've heard, but how are your employees reacting and how do they feel about maybe are you getting a sense from them on the broader reopening idea? Is it positively received?
Sure, this is Kelly. Can you all hear me?
We got you. Thanks, Kelly.
Great. So a quick background, we're a plastic injection molder manufacturer, approximately 200 employees in Sturgis, Michigan. And like some of you, we've got parts of the business that are deemed essential, the medical product line and some heavy truck industry. But overall, we're probably running, you know, 8 to 10% of the business right now. So the total count is pretty minimal. And we've done protocol for that group of personnel that are in, but they're very comfortable because it's, you know, in a facility that may have 45 people in an area, there's, you know, 4 people now. So in terms of like reopening and going on that path, we're hopeful that May 4th is a good start week to try and bring back a lot more volume, and have done a lot of the prep as others have in terms of temperature taking and protocol. In addition, we've actually outfitted, we have an assembly area that had people closer than 6 feet. So we've spent this time to do barrier separations between each of those work cells, revamp the entire ventilation system over there, and kind of go down that path. Like the others, the process of assessing risk on the positions, we've classified those positions, and then for PPE to come back, you know, some of those people will be required to wear the full face shield because they move through the facility too much and will have a lot of exposure. So we're trying to think ahead in terms of if you had somebody with a case, now what do you do? Where all did they go? How do we trace their movements? So that's been kind of some of the focus of myself and some leadership group to prepare for that. From employees' perspective, you know, early on, people were really wigged out right at the start before the shutdown measures started. We had people that didn't want to come to work. Now people are antsy to get back, frankly. We still have a little bit because we're calling in for this medical. The $600 federal money is getting interesting in terms of people declining to come back because they can sit home and make more. So that's been a little challenging. You know, as a corporate structure, we're going to change that when we all can come back. And so then that will, you know, kind of be some denial of unemployment if people are refusing at that point. But from a safety perspective, we had already done some shift changeover variances. We have a hands-free clock in at this point. So there's a lot less of that going on where people are too close to each other. And the sheer nature of our business, because you're at a press and a work cell, you're probably, you know, 25 feet away from the next cell. So we're limiting break rooms, those kind of things. Actually looking at having some people maybe take breaks in their car if you have too many at one point to kind of keep your break rooms in better shape. And then we've actually bought some of these automatic door things that you can hit with your feet. So nobody's doing all of the hand touching of a lot of common doors and restroom doors and those kind of things.
Wow. And Kelly, you're talking, you're in a position where you haven't been operating. I mean, do you feel that if you were operating today that you could keep everybody safe, whether forgetting the non-essential, do you feel that you'd be in a position to operate safely?
Yes, we've secured, we've got all of the cleaning product, we've got the protocols in place, we have the thermometers for, having what I'll call much more full production showing up where you actually have more than, 5 people needing to clock in. And so we are really comfortable with where that's at. The communication from most of the employees, because we're obviously having weekly communication, a group is on furlough right now. They're very interested in coming back and comfortable with where we're at. And we're going to provide face masks for everybody who wants them. And then there's other requirements for ones that we think need additional protection, both for themselves and then just in terms of if somebody got sick because they have too much movement in the facility.
Got it. Great stuff. Just a couple observations of the conversation so far of how you're preparing, even in the midst of things not happening, and some even before it really kind of became as broadly apparent as it is, the innovative solutions that you're bringing to this and how business can be part of the solution. Of keeping people safe, and sometimes I think that, we want to go to our public officials and be helpful in the process. So maybe I'll open it up for others if there's questions for those who answered, or if there's other comments on this topic, we can do that briefly before we go to our second round. We'll have another round of conversations here shortly. But any other comments? I'll kind of open it up at this point.
This is Kirk Wilkes with Mon & Hummel. I run a international company with about 21,000 employees. And in addition to all the measures talked about, I think looking at the environment as well from a filtration or a negative pressure, trying to create an environment where we can use the facility itself to help us. This is what we've learned from some of our other factories also in Asia, similar to you in terms of learn. So where possible to add HEPA filtration, we are. And yeah.
Great ad there. Yeah, absolutely. Anyone else? Want to make sure we kind of keep the dialogue going here. I think Kurt, when you talk about, so a couple things come to mind. One, the air filtration. I know we have a home air filtration product in Asia that's that has been hugely popular right now, as you can imagine. So creating a good air system in a work environment would be really important. And a lot of these best practices, Business Leaders for Michigan has a website. I think it's COVID-19 or blmcovid19.com that is really trying to bring all these best practices together. It could be a good resource for a lot of other member companies along the way. All right, I'm going to kind of go down, switch gears here and go to kind of the second area of discussion as we go here. Let's talk about the recovery plans, maybe a little bit more specifically. We addressed those before. Is there a way that we could kind of, and the topic is how can we kind of bring some of these similarities, these best practices, and really implement them across the way that all businesses could agree on, so that, one thing we've heard a lot of, employees, especially if they're close to your company, they know that they can be safe. But maybe for some of the other industries where there's much more customer interaction with the public, maybe there's a few other things to think about there. But I'm going to start. Matt Hayworth is on the call. So Matt, let me kind of go to you and give us a little bit of your perspective, how you really can bring people back and have that confidence. What are the things that are common that you could share that could give a lot of confidence?
And wherever anybody that's listening or however you are listening, I hope you and your family is safe. To give a little context in my answer to your question, Doug, Hayworth is a global organization. 3/4 of our business is in business office furniture. So we're helping a lot of people deal with this as we speak regarding their office workers. and about a quarter of our business is residential furniture for homes. And we operate with about 8,000 people around the world, including 2 production facilities in China. So we've been dealing with this for quite a while in 2020, as well as 4 in Italy, 3 of which are in Lombardy, several other plants in Europe, North America, half a dozen of which are here in West Michigan. And, you speak to the BLM COVID site. I think that's a great site that I really encourage people to visit and to benchmark best practices. We've all been learning what those best practices are. 3 of ours, both for the office as well as for production, include things like a health certificate form, something that you ask your members or employees to engage in, because I think that's important because it makes them think about their health. Relatedly, the policies that you have for attendance, I think this is a great time to not penalize people for self-selecting out and saying, you know what, I have a fever, I have a symptom, I've got to work from home. So I would mirror a health certificate form with really looking at your policies that don't penalize people when they have a symptom from staying home. I think another idea that we have employed for quite some time is cleaning protocols to really make sure you're fastidious of that. Not only on a regular operating basis, but have a plan in place if you find an employee or a member that does end up being COVID-19 positive. I think there's a whole different rigor of contact tracing to look who's worked near them, to be able to clean that site in a different manner. And then, of course, we've spoken a lot about social distancing and relaying out work cells, or in the office, we call those work points. And what's the equivalent in the office of PPE? Is it a screen? Is it a cube, as an example? So I'd say those 3 things, the health certificate form, cleaning protocols, and social distancing aspects, I think are just 3 of the great items that are on that BLM COVID-19 site. And when we follow these and the additional ones that you'll see on the BLM site, our experience so far, based on the most recent information I have, is that our employees are equal to, or in most cases, much healthier relative to COVID-19 than the general population they're a part of.
Yeah, that's a huge element, and that I've heard some numbers. There's some instances with big employee populations, more local, that the improvement is over around 40 up to 40%. So not only are they not getting COVID more than the surrounding, they're getting it significantly less than the surrounding population. Kind of the same theme of being very, very safe at work beyond being safe living. But we can learn many of these things we can apply really even maybe outside the workplace. All right, let me keep going and shift in industry. Thank you, Matt, for your comments there. Appreciate it. Ron Gaisman from you're doing the tool and die work at Lomar. How are you looking at some of the distancing that Matt talked about, safe distancing, and some of the other aspects that we've been bringing, if we can get at those 3 or 5 common areas?
Well, currently we are an employee of like 125 employees, at least prior to April, and now currently running about 50% of that. So struggling to stay operational, you might say, and have several customers that are deemed essential and was directed to stay open and stay operational. So, we're struggling along in those efforts. But again, like most of the other ones, continuing to clean at all the different facilities. And, we're doing the whole, we were able to get some infrared thermometers and, have those set up, and we're taking and recording everyone's temperatures every morning. And, before they come in at each shift. So also, we lock down all of our buildings and, trying to monitor everybody that's coming in and out and trying to keep it strictly to the employees there. But most of our machines are large enough that, again, the 6-foot distancing is pretty easy to tame just in the different cells and areas per people. And then especially with the limited workforce, we've been able to keep that, going along good at this time now. it is a big concern. Every time we try to determine when we're going to start back up at full capacity, there, the concern is out there of how many people they do we want to allow in, and how big can we get this operations without, getting in on that, the distancing out there. So.
Right, right. When do you, if you were back, I mean, one of the things you talked about was really controlling the population. A lot of others brought that up too, about how to really control the and enter, those who are even in the facility. So does that factor in? And do you see potentially a phased step back, rather than going to where you were, take a step and keep learning?
Yeah, that's exactly how I see it. I would hope that, I mean, I don't know when the end of this will be, but yeah, the constant cleaning, that we're currently doing, I would hope that that could all slow down going forward. But we're struggling, just trying to keep the maintenance people coming into work, in order to clean the different, bathrooms and break rooms and such too. So, relying a lot on the individual people and asking them to, clean, their work areas, when they get to them and before they leave them, and trying to keep those efforts going forward.
There's lots on this call who are working right now. They've been deemed, again, I don't like the term essential, but there's a lot who are just trying to hold the band together so that there's a job to come back to. And really grateful for you and others who are on this call who may be in that situation, who really are caring for your employees and trying to hold it together so there is a spot to come back. Another reason of why it's so important to move through this and keep moving forward. Let's go to Beckham. Steve London, tell us a little bit about your business and kind of how you look at these, at this recovery and some of the things that we can do, these on-site processes, to coalesce around as a business community, if you will.
Okay, thanks, Doug. Beckham is an OEM of extrusion plastic blow molding machines. So we are deemed a critical supplier. Our customers are producing a lot of various hand sanitizer bottles, alcohol bottles, from very small up to 275-gallon totes. Since the beginning, we've been phased through the whole thing with a spare parts service. Our territory is North America, Central America, and the Caribbean. So we've had to deal with people on the West Coast, people out of the country, getting them back in the country, and then a quarantine period. But to the phase startup, a few of the things, all of our machine is pretty much custom built, a little bit different than injection molding. Probably 70% is standardized, the rest is custom. So a number of disciplines between electrical assembly, mechanical assembly, machining, fabrication. Some of them are quite easy to keep separate, just because of the machines and the workstations. But final assembly, it does become difficult to separate final assemblers, electricians, engineers who are doing startup. And what we've gone to is really a split shift, where we're bringing disciplines in, keep them apart from each other, and with a pretty sizable gap in between, about a 3-hour gap between the first shift and the second shift, to facilitate some cleaning in between and some time break between. We have also cut our working hours. Excuse me here. Most of our people were on nearly 70 hours a week before this started. We've cut that back down to 50 to 55 hours a week, just to try to keep employees from getting fatigued. 6 days a week we were at. That's one thing we're trying to do. We see, quite honestly, Doug, a phased in is what we're hoping for. And starting, if May 4th is the day that we can go back to phase in the first wave, keeping people separate, 2-week interval, bringing the next wave back. even at the end of that, if we look at June 1st, we're still struggling. What do we do with at-risk employees, whether it's their own health conditions, whether it's that of someone living at the house? That's one big concern we have. We don't want to put anyone, make them feel like their job's at stake. If they have a parent living with them, or you know, a spouse who has a compromised immune system, or a child, or what have you, that's going to be one of the struggles. Getting back to 100%, even on June 1st, is going to be difficult. Majority of the employees are happy that they're here. They're happy they're working and have a job, that we're doing everything. But as the density increases, it's one of the things we're worried about. How do we keep everyone safe? And the biggest is we keep a COVID-19 case out of the building, because that's gonna be catastrophic to the business. How do we shut down completely to disinfect, and then keep employees' confidence back, get them back in the building?
Yeah, great. I mean, you hit on it exactly, because it's so important to you know, have the confidence of the employee, of the workforce, so that they can go back. You mentioned a couple things. I want to go back, maybe open it up now for a little bit more discussion. You talked about a diverse workforce coming from different locations, potentially quarantining at home, or some of the risks at home that as a business leader, you have to think through, because when they go home, if they bring something back in, even with all the protocols, if somebody brings it back in unknowingly, there could be challenges. I thought Matt's idea, the attendance policies and the health certificate, those are some pretty interesting things. So let me kind of open it up. And any other thoughts on these 3 or 5 things that we can kind of get our minds around? Some of those ideas. Have others implemented any change to your attendance policies? I mean, you're all doing things differently, but from the attendance policy, so somebody doesn't feel you know, the need to push it if they're not feeling well. I'm going to have to call on somebody again. I may go back to Van Gessel to raise the question, or give us a comment.
Doc, this is Birgit.
Hi, Birgit.
How are you? I have a question for the group, because I've been listening to all of the best practices that everybody has been sharing. And we had a meeting with our Information Technology Council of the Right Place, so bear with me for a minute. I'm not an IT person, but they want to create an app that brings together all the best practices to keep, quote, the community safe. Is this something that would help? I'm asking the question because I've heard so many companies now speak. Here's what we've done. Here's how we're keeping our employees safe. Is there a and you asked the question, how do we aggregate all of this good information in one place, so that other companies who are not on this call, and there's, you know, a few thousand of them, can tap into something? Would that be of value? I have no idea. They asked me. I haven't heard of anything like this anywhere. I'm trying to get in touch with my other economic development partners around the country. But if that would help, we could certainly try to have those IT folks work with people on this call and others on aggregating best practices on how to keep your employees safe, which keeps the community safe, which gets us back to work.
Yeah, that's I have heard that a little bit. The apps I've heard so far are more just doing a little bit more personal health tracking. But I've heard some of them, they connect the personal health. You do a questionnaire on your phone on the app, and unless you get a green light, your card won't work to give you access to a facility. So there's other things like that. And the other side of some of the screening that I've heard, whether it's an app or not, kind of does go back to, I think Matt was referencing that you can be much safer than the population around your workplace. But that's a good one. We'll follow up. There are a couple things on that. Does anybody else on the call have a comment to Birgit?
You know, just this is a Kirk again. Just in the short term, we've been relying heavily on Southwest Michigan First. They're pretty active on our side of the state, and they're doing a fantastic job of getting the companies cooperating with them and sharing information openly. There's no competitive advantage to hiding this information. We want to get it out there and let people benefit so we can all get back to work.
Yeah, well, Ron Kitchens is my colleague in Kalamazoo. I have his job in Grand Rapids.
Hey, and Brigitte, Doug has shared, as I reinforce, the best coalescing I've seen so far is the BLM site. That touches on items that are both good for production as well as the office environment. And again, Hayworth, in addition to me being concerned about that and monitoring that, because over half or 2/3 of our members, as we call our employees, are production, but we also have a lot of expertise in the office. And while more office work can be done remotely, we can share some of those ideas with you. And Hayworth is a great source when you're ready to open up the office portion. We've already been supporting a lot of global accounts as well as non-global accounts on dealing with that very thing, from just modifying their existing work environment to kind of clean sheet ideas, depending on how far they want to go with it.
Guys, I would jump in from an automotive side. There's some good things out there. Just if you Google them for like safe playbooks. I know Magna Corporation has put some stuff out, as has Lear, that are actually very helpful. Now it's a production base, but there's also health screening things on there, and there's even signage in the back of this safe playbook that you can then customize and put your own logo in and use all of those things for different signs you want to put out in different aspects. And then one other point on the app for the health screening, I have heard that in terms of being able to tie it into your swipe cards. So as you said, you're not allowed to actually clock into the process if you don't have a green light on the health screen. Those get a little different, and you have to work with an IT person because those then have to be customized to your own time clocks from a manufacturing perspective. So there's a little more cost associated when you try and tag that level in. But even the first level of getting your people to screen on their cell phones is helpful.
Hey, Doug, our at Elko Enterprises, we have people that are spending a lot of time, countless hours on webinars and things like that. There's a lot of information out there through MMA and people like that. Like they said about Magna's got a great document that's out, as well as MyOSHA has released quite a bit of documentation as well. The one thing that we've had concern with here is obviously we want to be able to track strategic health history questions, temperatures, things like that to not admit somebody into the building, but also we have concern for protecting ourselves from liability of accidentally or not taking the right steps to allow somebody in the building, and then that having a negative consequence on us as a company.
Yeah, great comments.
Doug, I would add too, just as an industry source, AGC and ABC have really good protocols that I think, those that own the companies that are considering construction can point their builders to that are very specific to our industry as well, and on protocol and how to proceed.
Great. Well, I think I really, as the discussion goes, and I've been in a few of these, and it's amazing how everybody, and I think Kirk, you nailed it. This is not a competitive advantage. This is everybody just helping each other. And not only is there a lot of innovation in the business community, there's a lot of generosity. If you figured something out, it's not a trade secret. It's a health issue. It's a public health issue, and we all want everybody's employees to stay well. So
I think we all want everybody to get back to work in a safe way. That's the goal, right? So
you got it. Yep, absolutely.
We don't want this to continue to go from person to person, so we need it to stop too, right? So
you got it. We have, and that's where a lot of good work has happened. So we got a few minutes. I know many have been on the call for maybe an hour or so, so I'll try to kind of wrap it. But I do want to kind of open things up, because our idea here is to share good practices, share ideas, try to coalesce around a few things, and really the role of the business community to help our public officials. And so we've mentioned the plans that are out there. And so if we could give a message back, whether it's to Senator Shirkey or it's to others or to the governor, if they could give a message back, is there maybe the last little round, I kind of go around, if there's some thoughts, if you have a quick thought we can share, we can track these down and try to make sure we capture this incredibly rich and important input. So any comments?
Doug, Matt Hayworth here. Can you hear me?
Yeah, I got you, man. Go.
I believe that the virus is going to be here, unfortunately, for a long time in some form or another. And there's going to, until we either have a vaccine or herd immunity, and there unfortunately is going to be a second, third, or fourth wave. And I think the experience that we're sharing here on this call, having started with it at least in January in China, very intensely in Lombardy, is that I think we can operate safely, as safely or more safely than the general population, even with the shelter in place activated. We operate in under many different orders by country, or quite frankly here in North America. And I think that we've got to adopt that. More important than defining what's essential, I think it's to really live these practices, to communicate them, to share them, and to live by them. And I think that we have to really demonstrate that we can operate. I think we already have demonstrated, but we really got to demonstrate that we've learned, continue to learn, and can operate safely and begin to open up not only the state of Michigan, but our country and the communities we're part of, for everybody, for their health and for the strength of our community and our state. Thanks for the opportunity to share, Doug.
Great. Thank you. Thanks, Matt. Others who have a comment to share?
If anybody wants the layer and the playbook from Magna, we have them both. I'd be happy to give them to somebody who can share them with everybody on the call if you're interested. They're really good.
Yeah, excellent. Thanks, Birgit. Others, any other comments? Those who've been on, just dying to dive in?
John,
Hey, John.
appreciate being on. Real quick, I'm involved. I'm not running anything anymore, but on a few boards globally, all in the healthcare products industry. So they've been running all along because of their criticality. Many of the safety things that everyone's talked about, they're doing kind of the extreme level because of what they deal with. I think even with that though, and most of us deal with very broad global supply chains now. And so their big issues is they're running out of ingredients. They're running out of things that come from other countries. I heard Italy, I heard other things. And making that all click in a smooth way takes a lot of time. And so in my mind, I think there's this fear that once we open the floodgate, everything will just go. I see it that way. I think it'll act a very slow, methodical ramp just because of everything has to connect together to get it going.
Yeah. Yeah, exactly. Very, very well said. That, not only from a health perspective does a phased approach make sense, but just really getting the machine running again. You can't just flip a switch to have it go. On other calls I've had in other markets as well, it's the same, the same thing. That's the supply chain network is so intricate. It's not just one piece. Great. Thanks for that input.
You bet.
Other comments? We got maybe a couple more minutes. Want to be respectful of people's time, but want to get conversation too. Yeah, please dive in.
Bill Dobbins. Again, making it simplistic, I would just ask the governor and her staff to trust the business leaders in this state to do the right thing for their employees, for all stakeholders. That we're not dealing with a bunch of idiots here. Obviously, this group is very concerned about their employees. We all realize the difficulties that we have in front of us, and we're going to make the right decisions going forward. Allowed to make our decisions and make great decisions, which we've done for years and years and years.
Yeah, excellent, Bill. Great comment.
Hi, it's Jennifer Owens with Lakeshore Advantage. Question maybe for Andy or Jace related to the governor's task force that she's pulling together from a business perspective. Do we have any idea if someone from West Michigan is part of that advisory group? She announced just before this call that she had a task force and she was going to make some Friday announcements about going back to work.
What I heard is that Tina Fries-Decker from Spectrum Health is on the task force.
Others? Jace, Andy?
I am pulling it, the other one. I'm not positive if this is a new one or if it was the previously existing one that was kind of under, associated with, tangential to BLM. It's been kind of associated with BLM. Pulling up, if that's the one, so it's its own effort. Of course, that's
the MERC.
Chaired by Jerry Anderson from
yes. That's
Yeah,
Shared by
then I think, yeah,
Jerry
Jim,
Anderson from DTE.
correct,
West
correct.
Michigan. So to your question, Jim Keene from Steelcase, Blake
Andy
Kruger,
Owen from Herman Miller.
Blake Kruger from Wolverine. I'm
And
scanning.
Rick Keys from Meyer.
Yes. Yes, those are West Michigan folks.
And then,
Otherwise,
but I heard
Bethany
today
on
that there's
there.
another one that includes healthcare folks. And I heard that Tina is going to be on that one. So I don't know if the two overlap or if that's a different one for the governor.
So I'm looking at an article dated April 4th in Cranes that lists the two committees. It lists a healthcare group and a business group. And it says that Governor Whitmer announced it. So if that's the same group, that list is available again in that story on April 4th in Cranes. And you might contact anybody you know that's a part of that to see where things are.
Yep. I think those are the groups, Jace, and I do know that they're all working together. It's a very coordinated, collaborative effort with the health community because that's a vital piece of this. Yeah, because we want it science-based too, right? I mean, everybody you want to have data, you want to have science. Great. Maybe one more comment. Otherwise, we'll kind of bring it to a close here.
Doug, Mike Hill here. Just going to put Johnny on the spot, wondering if you might be able to just offer us just a little insight on what this has meant for his industry.
Hey, Mike, thanks. A lot of takeout, delivery, that's been all we can do. The biggest challenge and there's a lot of issues to talk about, but one of them for Michigan specifically is most on the call know that the businesses in Michigan will have a hard time getting the benefit of the federal PPP plan because of the 8-week window. So it might be something to consider. It would be great if the governor's administration and the federal folks can get together and have a conversation because that 8-week window on June 30th will be a challenge. So specifically to the hospitality industry and many other businesses, retail or otherwise, that won't be able to open within that 8-week window, it wouldn't apply because you wouldn't be able to have enough payroll on. So that's something to consider, to have those two groups have a conversation on the federal and state level. But in general, Mike, it's first time in 85 years of our family business we've had the restaurants closed. So it's really tough. But we're doing our best with take and bake, grab and go, delivery services, and just regular takeout.
Yeah, thanks for asking that, Mike, and Johnny. Thanks for your comments back. Let me just kind of bring it to a close here and thank everybody for your participation. But I want to observe in that one another aspect here of how many regulations have been waived because of the crisis, whether it's in the healthcare area. Or like in the FDA, you may be hearing a lot of that. I think there's a lot that we can do looking forward. So why were those regulations here in the first place? So from a West Michigan Policy Forum perspective, there may be things that we just baked in over years and years that slowed us down as a state getting ourselves back going again. So that's another great one to raise as you identify it. So maybe as we come to a close, first I want to thank everybody for your participation, your engagement. It was mentioned earlier, trust everyone is staying healthy, that your loved ones are as well. And for all of you, you're at different stages. There's some businesses who are operating, there's some who are not. There's a huge variation and tremendous amount of stress. And I would just, on another call, recognize that COVID-19 isn't the only health challenge out there. There's depression, there's isolation, there's mental health, there's other sorts of things that are really starting to ramp up. So we have, our public officials have some very difficult decisions to balance. And we appreciate that. And no one's going to be perfect. None of us are perfect either. But the more we can come together to try to provide good, solid, data-driven input, like some of the plans that we're seeing, we certainly hope we can be helpful to our leaders, to the governor especially, so that wise decisions can be made, taking a lot of different factors into account as we go forward. But we will be tracking all this data, all this input, this whole conversation, and synthesizing it, bringing it together. I want to thank you all for your participation, for your engagement. I want to thank you what you're doing for your employees, for your families, for your communities, and how you are putting your hearts into everything that you do. We're so grateful and so blessed throughout the state of Michigan to have business leaders like all of you on the call, and so many others who are not on the call that are just working their guts out and really putting their customers, their employees first. And in times like this, overwhelmed with how they can take care of them. It's not that they're taking care of themselves, they're putting others first. We're seeing that in our community, certainly in our healthcare community. And so we're grateful for that. So with that, I'm going to turn it back to Aaron. And thanks for your participation. Aaron, over to you.
Hey, Doug, thank you. Thank you to everyone who's joined us here on this Zoom call. We appreciate your input, and we'll keep you updated if additional information comes out of our work at the West Michigan Policy Forum. This event will be posted on the West Michigan Policy Forum Facebook page if you'd like to watch the program. Stay healthy and have a great day.